Vegan and vegetarian diet and vitamin B12 deficiency. Vitamin B12, also known as cobalamin, is an important water-soluble vitamin. Vitamin B12 deficiency is common and can present itself in various ways, making it difficult to identify. Vitamin B12 plays an essential role in the production of your red blood cells and DNA, as well as the proper functioning of your nervous system. Strict vegetarians and vegans are at high risk for developing a B12 deficiency if they don't eat grains that have been fortified with the vitamin or take a vitamin supplement. A serious vitamin B12 deficiency can be corrected two ways: weekly shots of vitamin B12 or daily high-dose B12 pills. A mild B12 deficiency can be corrected with a standard multivitamin. If you are a strict vegetarian or vegan, it's important to eat breads, cereals, or other grains that have been fortified with vitamin B12, or take a daily supplement. A standard multivitamin delivers 6 micrograms, more than enough to cover the average body's daily need. Symptoms of vitamin B12 deficiency: breathlessness and/or dizziness. Anemia caused by vitamin B12 deficiency can cause some people to feel breathless and dizzy. This occurs because the body is unable to transport enough oxygen to all its cells, because your body lacks the red blood cells to do this. Pale or jaundiced skin. If you have a B12 deficiency, your skin may appear pale or jaundiced. People with a B12 deficiency often look pale or have a slight yellow tinge to the skin and whites of the eyes, a condition which is known as jaundice. Vitamin B12 plays an essential role in the production of the DNA needed to make red blood cells. Without it, the instructions for building the cells are incomplete, and cells are unable to divide. This causes a type of anemia called megaloblastic anemia, in which the red blood cells produced in your bone marrow are large and fragile. These red blood cells are too large to pass out of your bone marrow and into your circulation. Therefore, you don't have as many red blood cells circulating around your body, and your skin can appear pale in color. Changes to mobility. The damage caused by long-term, untreated B12 deficiency can affect your balance and cause changes to the way you walk and move. It may even affect your balance and coordination, making you more prone to falling. People over the age of 60 are more prone to a B12 deficiency. Preventing or treating deficiencies in this age group may improve mobility. Mood changes. Some people with B12 deficiency may show signs of a depressed mood or conditions characterized by a decline in brain function, such as depression and dementia. It is suggested that high levels of homocysteine caused by low levels of B12 could cause damage to the brain tissue and interfere with signals to and from your brain, leading to mood changes. It is also suggested taking B12 supplements may reverse symptoms. Pins and needles. B12 plays an important role in the production of myelin, which insulates your nerves and is critical to your nervous system function. A common sign of potential nerve damage in B12 deficiency is a sensation of pins and needles. Without B12, myelin is produced differently, and your nervous system isn't able to function properly. One common sign of this happening is paresthesia, or the sensation of pins and needles. Glossitis and mouth ulcers. An early sign of B12 deficiency may be a red and swollen tongue. This condition is known as glossitis. The inflammation can also make your tongue look smooth, as all the tiny bumps on your tongue that contain your taste buds stretch out and disappear. As well as being painful, glossitis can change the way you eat and speak. Some people with a B12 deficiency may experience other oral symptoms, such as mouth ulcers, feelings of pins and needles in the tongue, or a burning and itching sensation in the mouth. Weakness and/or fatigue. When you are deficient in B12, your body isn't able to produce enough red blood cells to effectively transport oxygen throughout your body. This can make you feel tired and weak. Weakness and fatigue are common symptoms of vitamin B12 deficiency. In the elderly, this type of anemia is often caused by an autoimmune condition known as pernicious anemia. People with pernicious anemia don't produce enough of an important protein called intrinsic factor. Intrinsic factor is essential for preventing a B12 deficiency, as it binds with vitamin B12 in your gut so that you are able to absorb it. Blurred or disturbed vision. In rare cases, the nervous system damage caused by a B12 deficiency can affect the optic nerve. This can result in blurred or disturbed vision. The damage can disrupt the nervous signal that travels from your eye to your brain, impairing your vision. This condition is known as optic neuropathy. This symptom is often reversible with B12 supplements. High temperature. On very rare occasions, one symptom of B12 deficiency may be a high temperature. When this occurs, some doctors have reported cases of fever that has normalized after treatment with low levels of vitamin B12. However, it's important to remember that high temperatures are more commonly caused by illness, not a B12 deficiency. Health care advice. If you feel you're at risk or have any of the symptoms above, please speak to your doctor or health care provider. If you enjoyed this video, please click the like button. We need your support to keep posting, so please subscribe and click that bell notification button so that you get notified when I post new videos. And if you would like, leave a comment below. Thanks for watching and I will see you in the next video.